Welcome to Hope in the Face of Cancer, where we share real stories of courageous people in their cancer journey. Today, we are honored to have Dr. Candy Arentz, a breast cancer surgeon and passionate advocate in oncology care. With a career focused on surgical excellence and compassion, Dr. Candy has touched countless lives with her expertise. Known for her patient-centered approach, Dr. Arentz emphasizes the importance of nurturing both mind and body. As a longtime CanCare advocate, she has seen firsthand the powerful role of hope and emotional support in recovery. Dr. Arentz not only saves lives, but also offers compassion and strength to those facing the challenges of a cancer diagnosis. She shares her journey as a surgeon, insights into the latest advancements in cancer treatment, and the moments that fuel her passion for patient care. Dr. Arentz, thank you so much for joining the show today.
Oh, and thanks for having me. I've been looking forward to it.
Yes. Well, and thank you just for what you do. I mean, your incredible commitment to our cancer community and heart is so evident. And I'm so excited for our listeners and viewers to get to know you today and to see that heart.
Yes. Well, once again, thank you for having me. And as you know, cancer touches all of us. It's
Yeah,
so prevalent. 1 in 2 or 3 Americans will have cancer. And so that means all of us are affected.
that's right. That is so true. Well, I would love to kind of start with our audience and with your origin story, if you will. How did you decide that you wanted to become a doctor and specifically become an oncologist?
Sure. Well, in a small town long ago, far, far away, is where I grew up. I was really the first generation college graduate in my school. My dad had gone to some college, but really they worked on the farm, and we lived out in the community. And I was babysitting for a physician who was a surgeon, and he's actually still in practice here
Oh, wow.
uh, over in Spring. And I and my aunt used to babysit for his kids. And one day he asked me what I wanted to do when I grew up. And I said, well, this seems pretty good. And so, we really didn't have any physicians in our family.
Yeah.
And so I was like, let me try this.
Wow, that's incredible. I mean, I can only imagine how proud he is of having influenced your career in such a way. It just shows that you never know who in your life can be such an influence on you.
Yes, and he's still a great family friend. And I think that mentoring and mentorship is so important
Yeah,
when we're young and for our children to remember that you can find a mentor really anywhere.
that's
And
true.
he took me under his wing, and I worked in his office when I was in college, and even
Mhm.
before then, when I was in high school, he had a little laparoscopic set so that I could practice doing surgery in a little box, but really walked me through the steps of how you become a physician and then how you become a surgeon. I really made sure that that's the path that I wanted to take. So I did everything in his office, from cleaning the exam rooms to calling and doing collections. So
Oh, wow.
it's a
It's
great.
funny when you mentioned that set, the first thing I thought of was like the game Operation, but I'm sure it was a little bit more sophisticated than that.
A little bit, but it's all the same thing. It's concentration and
Yeah.
trying to the hand-eye coordination.
So you get into medical school, you know you're going to be a surgeon. Kind of what drove you into oncology specifically?
Sure. And once you're in medical school, you rotate through
Yeah.
everything. And I was really drawn to surgery and knew I wanted to do residency in surgery, but it's very competitive.
Yeah.
And so I matched my surgery residency in Lubbock, not exactly a place that I had on my top 10 list
Mhm.
of places to live in my life. But we open an envelope in a big auditorium one day, and it tells you where you're going to spend the next 5 years of your
Oh,
life.
wow. I didn't realize that.
Yes. And so mine was Lubbock, and I went out there. My parents drove me, and it was really a great place to learn. Texas
Yeah.
Tech is an amazing university,
Incredible.
sciences center, and it's where you grow up as a
Yeah.
baby doctor. You grow up during residency. And I liked all of it, but I really enjoyed the patients in my oncology and cancer rotations. Breast cancer is not one of those cancers that you do to yourself. And you would think that patients may be a little more agitated because they have cancer that really they had no part in
Mhm.
getting, but they were the most understanding
Mm.
and kind and really just wanted help. And so I was very happy that I was there to offer that help and that hope in the future that we could cure this and that we could move on with their lives.
Oh, that's incredible. And we're so grateful that you decided to take that path because you've made such an impact. I know we had talked previously about early in your residency, some ahas that you had that really drove you and drove some of your early work. Can you talk to us a little bit about that?
Sure. As a surgery resident, we went through and would take care of breast cancer patients, but then I really didn't know what happened to them
Mm.
afterwards. And so, if they saw the surgeon, most of the time they had surgery first. And if they saw the medical oncologist, sometimes they started with chemotherapy. But there really wasn't good coordination or communication with the team. And I just thought there was a better way that patients could be taken care of. And so when I decided that I wanted to proceed breast cancer surgery as my career, I looked at several different fellowships. And so fellowships are additional training after your 5 years of general surgery training that really allow you to focus in on one specific area. And so my area was going to be breast. And I looked across the country to find a place that I would get the best education. And I actually trained at the University of Arkansas for medical sciences there in Little Rock. And it was very similar to Lubbock. So I knew I was going to come back to Lubbock to start the breast cancer program there. And so Arkansas was very similar in that it's a little smaller town, but patients travel for hundreds of miles to get health care.
Yeah, absolutely. So talk about kind of the approach that you brought in terms of kind of trying to bridge that gap. It's a little bit like, well, who's on first, right? So how did you go about kind of making a more holistic approach and making it easier for those that you were serving in those early years?
It's all about keeping the patient as the center. If you can focus on the patient and then work outward from there, I think that that's how the best cancer programs are developed. When patients are driving a couple of hours to come in to see you, trying to get multiple appointments on the same day, get them to see medical oncology and surgery on the same day, or at least get some scans or some blood work done. Any of those things that you can work with the healthcare team goes a long way and really helps our patients truly know that there is hope and that they will be able to finish treatment, because cancer has taken so much from them that I try to be the least intrusive as I can. And so the least number of days or number of hours that they can spend wasted, not necessarily
Yeah,
wasted, they're at the hospital, but waiting or
right.
driving back and forth to the hospital, those are wasted hours. And so I'd like to be able to fill those and get really the most bang for their buck when they come in and are having to travel.
No, that's incredible. That's incredible. You also have really taken leadership roles outside of your role as a surgeon because of your passion and just really being patient-centered. And one of those roles has been with the American Cancer Association or American Cancer Society. Tell us a little bit about your experience with that and with the Hope Lodge and what you learned from that experience.
Yes, so while I was in Lubbock, I was on the board for the American Cancer Society, and it was a great organization, or is still a great organization,
Yes.
and a resource for patients. The Road to Recovery program, it really helped get our patients to Lubbock. Drivers and volunteers out in the community that would volunteer to drive people to and from chemotherapy or radiation therapy was so needed, because sometimes, husbands are working while their wife's undergoing breast cancer treatment and just can't always take off, or someone has to stay in the smaller town to pick up the children from school.
Yeah.
And that resource was great. And while I was in Lubbock, we were also fortunate enough to open a Hope Lodge. And
Yeah.
this was the first Hope Lodge west of the Mississippi,
Oh,
which,
wow.
yeah, and it's quite shocking because, west of the Mississippi is where things are more spread out, where you think
Yeah.
Hope Lodges would be more prevalent, but there weren't any. And so Lubbock and Texas Tech Health Sciences Center there, we're so thankful to have a place for our patients to call home while they were undergoing treatment.
And for those in our audience who may not have heard about the Hope Lodge, it is a place where you can physically go and stay while you're getting your cancer treatment. I mean, to your point, so many people drive hours or come from different cities. And so just having that place that they can call home, I think is critically important. And it really speaks to caring for the emotional needs and the needs outside of just the physical cancer treatment that person is experiencing.
Yes, the cancer treatment is hard enough. So trying to alleviate, break down those barriers and provide them a bit of comfort was so rewarding.
Well, I can really appreciate how you're not only so focused on your own craft as a breast cancer surgeon, but throughout your career, you've been really looking at the care of the whole person. Like you said, it's a patient-centered approach. And in that, I know that you have really looked at the emotional toll of what cancer can bring. So tell us about, as a physician, how you help your patients balance the emotional aspect of cancer care with the physical treatment aspects.
Well, it is definitely not a one-woman show.
Yeah.
So healthcare, as we know, is a full team. And I think having those resources available for patients is equally as important as having, partners who provide chemotherapy or radiation.
Yeah.
Having those partners and resources that can sit and talk with the patient, but more importantly, listen. And that's one of the amazing uh, aspects of CanCare is the one-on-one matching program that truly, as you know, I've helped train some of the
Yeah.
volunteers, and it's really training to listen. Because I feel like every patient who gets a diagnosis, and they tell someone, well, then that person wants to tell them about someone else who's had
Yeah.
cancer. But sometimes it's nice to just have someone to listen. And I try to do that in my clinic as well. I take time, I meet with all of my patients in my office right here at this
Yeah.
table. And I meet with them with their clothes on the first time.
I'm sure they appreciate that.
Important. It's one of the other things that I learned as a resident is these are humans, right? And
Yeah.
so we want dignity. And that's why I sit in my office around a table and talk to patients about their diagnosis and treatment before having them change into those gowns. Now we have great
Yeah.
gowns here at Houston Methodist.
Very fashionable gowns.
Vegetable gowns. But they're still gowns, and you still have that, that patient feeling when you're in the exam room. So I think taking that time to sit with them in a table with their family members around goes a long way and helps make that bond and that connection with patients when you first meet them.
Yeah. Well, we certainly appreciate your leadership with CanCare. Since we've been working with Houston Methodist Hospital for over 25 years now, which is where you are now at Houston Methodist. Tell us a little bit about just the impact that you see and how you've integrated CanCare and our survivor volunteers kind of into your day-to-day practice.
Sure. And I thought it was going to be very different when I moved from Lubbock to Houston, because now we're in Houston, the biggest and the best
Right.
center in the world. But still, we have patients who travel from hours away,
Yeah.
here to see us between San Antonio and Houston, and Houston Methodist West, which is where I am, is the furthest west radiation treatment. And
Mhm.
so people who need radiation sometimes still travel a couple of hours to get to us. And that's one of the places that we've integrated our CanCare volunteers is into our radiation and our infusion area. And so while they're here getting their treatment, they also have that emotional support. And having volunteers here in the hospital and in the treatment areas is also a great introduction. Once again, face-to-face meeting, you can't replace that.
Yeah.
As we're sitting here on a Zoom, and we all got used to it during COVID,
Yeah.
not having that face-to-face interaction. However, I think it's even more welcomed now because we went through a time when we couldn't meet
Right.
face-to-face, that people like that one-on-one and face-to-face interaction. And I'm so happy to have our CanCare volunteers
Yeah.
here.
Like that saying, you don't know what you got till it's gone. Yeah, I think COVID taught us to appreciate so many things that maybe we had taken for granted. And those volunteers, all of our volunteers, but those volunteers that serve in the hospitals, I mean, we call them hope on feet. They're just shining examples of survivorship and hope for those people who are coming in for their treatment. So we are so grateful to them.
And there's so many steps along the way for every cancer diagnosis that it is hope to move on to the next step, but also to meet someone who has completed that next step
That's right.
and that they're there and often just an ear to listen and
Yeah.
to give hope.
Somebody they can truly relate to because you can be surrounded by a loving friends and family, but
Mhm.
um, unless someone's kind of walked in the shoes you're walking in, it can be incredibly lonely and frightening at times. And so having that survivor by your side is so critical. Well, I know one thing that gets you really excited, and I know our listeners will be excited as well, is the advancements that you're seeing in cancer care and especially in breast cancer care. So, what are you most excited about? What are you seeing that really gets you excited about the future and um, increased survivorship?
Sure. There are advances along each step. And so we can start with advances in screening.
Yeah.
Just for a few years now, we've told women if they have dense breast, that they have dense breast. The problem was no one told you what to do with them.
Right. It's like, good to know. Okay, now what?
Know if that's good or bad. But now, thankfully, there are guidelines and better technology that we can see through dense breast. 3D mammograms are now
Mhm.
covered by insurance as standard screening. So you usually don't even have to ask for it. Most larger
Yeah.
facilities are going to do 3D mammograms to help detect even the smallest cancers. And now with dense breast, we know that adding ultrasound
Yeah.
to your regular screening mammogram also allows us to see through that dense tissue better. So now we know that we have dense breast, but also we have some way to look through them and to help find breast cancer early. And
That's phenomenal.
yeah, that just helps with screening. And we know that increased screening and screening on time helps us decrease mortality and find more curable cancers. And then when we find cancers, the treatment also has come a long way. And so sometimes patients still need chemotherapy, but we now have tests like Oncotype, these genetic analysis
Mm.
to really tell us who needs chemotherapy and to save many women from actually having to have chemotherapy at all. And to provide those women who need chemotherapy to be able to tell them you truly need it because we
Yeah.
often used to give it, but not everyone had a benefit. We just didn't have a great test to tell us who needed it. And immunotherapy, being able to use our own immune system to boost those treatments and to get a better response. What else? I could talk about targeted therapy.
What is
really.
that? I mean, that's a term that maybe most people haven't heard or they don't exactly know what it means.
Right. The chemotherapy was our traditional way to kill cancer cells. It kills cells that are growing faster than the rest of the body. But it truly is a poison that across the board kills cells. And that's why you lose your hair. That's why you have nausea, and because it kills those faster growing cells. And so targeted therapy is really, all due to our basic science researchers, those people behind the scenes who are doing the research to identify proteins on cancers that are different than the rest of the protein in your body. So really to find those targets that we can develop a drug to specifically kill those cancer cells. The most common and the well-known one is about a HER2. So HER2 is a protein on about 20% of breast cancers that now we have several drugs that can target those particular proteins. And we just finished a research trial across the US that is actually just giving the HER2 directed therapy without chemotherapy.
Wow.
And so those women don't lose their hair. They don't have the nausea associated with chemotherapy, all the neuropathy and pain in the fingers. So all of these advancements are really trying to decrease the side effects and the impact that we have on lives of our patients.
That's incredible. Very exciting stuff. And as you look farther out, 5, 10 years, kind of what maybe we don't know about or haven't heard about, what's coming? Like, what are you most excited about?
I think smaller surgeries, not that I'm trying to
Mm,
get myself out of a job, but I'll be happy to move on to something else if women don't need surgery for breast cancer.
yeah,
But we
amen.
know a lot of these treatments are truly killing all of the cancer cells so that often there's no remaining cancer in the breast. And
Wow.
so we have some trials open looking to see, can we prove that there's no cancer and maybe just do biopsies around where the cancer was? And then maybe they don't need surgery. And so
Yeah.
to be able to save a woman's breast and her wholeness and not go through the pain of breast surgery would be amazing. That along with the finding these new targets so that we can decrease the side effects for
Yeah.
women who need chemotherapy.
I think that's a good goal, working to get you put yourself out of a job one day is actually it's a great goal.
It'll be right when I retire. So
There you go. Exactly. Exactly. So we're seeing some trends in younger women, more and more younger women with cancer diagnoses, including breast cancer diagnoses. What would you say to the 20s, 30s women out there right now?
yeah, we don't know why. We don't know if we're more aware of breast cancer and talking about it more so that we're identifying it in younger women, that if you find a mass, you're more comfortable to tell your physician about it versus, then it just spread and maybe we didn't know why someone had cancer or really where it started. But it's important to know your body. And this is important not just for breast cancer, but really for anything. Young people get autoimmune diseases. There are many other health concerns that people have, but you know your body the best. You know if something's changing, and to talk to your doctor or talk to the next doctor. Unfortunately, not all of
Yeah.
us listen, and you have to be your own advocate. And I think that is what I would say to young people the most and loudly and repetitively is, if you have something that is different and that is new, don't just let one person tell you that it's normal,
Yeah.
because it's not normal for you. And so I think that especially people or women in their 20s and 30s who do develop breast cancer, almost everyone has the same story. I told my doctor and they thought it was fine. And
Yeah.
so it's important to speak up and be loud. And, if that doctor is not listening, find someone else. Thankfully, we are in Houston. We do have tons of physicians out here to get a second opinion.
No, absolutely true. I think it's so important for young people to learn what really being their own advocate means. What does that look like? And for there to just be unabashed about advocating for yourself and your needs and understanding your body.
Yes. Yes. For in all different aspects. But, I think that sometimes we don't speak up, and I think the younger generation, I can't believe I say that because it makes me sound really old.
You're still
But
part of that younger generation.
but I think sometimes we do lose that. We've lost some of that face-to-face interaction, and so then when younger people now in their 20s and 30s are face-to-face with a physician, sometimes there's a little intimidation and they don't feel comfortable saying what is wrong or how they're feeling. And I just think it's important to, as you said, be an advocate.
Absolutely. So agree. So as we wrap up our time together today, we have listeners who may have just found out that they have a cancer diagnosis, survivors, caregivers, healthcare professionals, all listening. From your perspective and your career and what you see every day, what message of hope would you want to leave with our listeners today?
I think the best news or statistic about breast cancer is that 34 out of 35 women who are diagnosed with breast cancer will survive and be survivors. So that is the hope. The hope is that you are one of those 34 out of 35 women, and that you had to jump through a few hoops to get there. I say that to my patients frequently, but overall, this is a curable disease.
No, that's powerful. I didn't realize that statistic. I mean, that's very powerful, 34 out of every 35 women. I mean, how that's changed so radically from just a few years ago. It's truly incredible. Well, I think that is incredible hope to give for our audience today. And just want to thank you for, one, the devotion of what you do. It is so wonderful to know that there are patient advocate physicians and oncologists out there like you. And just thank you for all the care that you give to our cancer community. We're so grateful to you.
Oh, thank you. And thank you. I appreciate CanCare and all of our volunteers. And it's such a great organization that I'm happy to be part of.
We're so thrilled you're part of our family. And we thank all of our listeners today for joining us. If you enjoyed today's episode of Hope in the Face of Cancer, we hope you will like and follow us so you can be notified of upcoming episodes. And if you or someone you love is facing a cancer diagnosis, CanCare is here to support you, no matter where you are in the United States. So visit our website at cancare.org to request a survivor by your side during your cancer journey. And if you are a cancer survivor or have loved someone with cancer, we would love to have you join the CanCare family as a volunteer to provide hope to someone along their journey. So visit our website for more information about becoming a volunteer. No matter your cancer connection, you can provide hope in the face of cancer to someone when they need it most by donating to CanCare. We hope to see you next time on Hope in the Face of Cancer. Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.